Good afternoon, everyone. This is Dr. Khan from Aesthetics International, and today we have an interesting game to play. That is Autocomplete frequently asked questions with yours truly. So, can lip filler move? Most commonly, it will move when lips are overfilled. Generally, from what we call the vermiliocutaneous junction, it sometimes moves up. When it moves up, it gives you like it's called a simian effect. Not very flattering, but that means ape-like. However, fillers can also move downwards. So, in short, yes, fillers can move. Number 2, can filler burst? Can lip filler burst? Okay, that's interesting because recently a patient told me about a friend who had too much lip filler put in and the lip burst. Well, yeah, in 20 years I really haven't heard that before. I don't see how it's possible, but clearly it has happened. Can lip filler look natural? Actually, this says look natural. But anyway, yes, lip fillers can look natural. You gotta basically think about restoration and not augmentation initially, because some patients will continue to lose volume as they age. Actually, most people will. And therefore, if you're just replacing a little bit of what they've lost, you're just taking them back in time and restoring what they originally had. So, yes, it can look natural. You might be surprised that people sometimes don't want it to look natural. This is another story. Next one. Can lip filler cause acne? I don't know how that would happen. No, lip filler cannot cause acne. Don't know where that came from, but people like to ask some interesting questions sometimes. Okay, can lip filler travel? So in other words, over the Eid holidays, can your lip filler happen to go to Montenegro? Generally, no, it doesn't travel. I guess it means can it move? But it's another way of saying it. Yeah, interesting question. So lip fillers have suitcases specially designed for them to travel. Can lip filler last forever? Sure. Of course, it can last forever. Permanent lip fillers will last forever. We spend a lot of time removing permanent lip fillers, which sometimes integrate with the lip, and we have to cut out bits of tissue from the lip. So anyway, yes, they can last forever, but it's not an ideal situation, and I wouldn't advise anyone to have permanent lip fillers. We can do lip filling with your own fat. It's a little bit of a lengthy process, and it can be permanent too. Okay, so can lip filler come out? I guess that means can it be removed from the lip? Yes, it can be removed in two ways. If it is very superficial and you have a little bleb, the surgeon can make a little nick under local anesthesia, give it a bit of a squeeze, and the lip filler will come out. We also have hyalases, and we're now talking about hyaluronic acid-based fillers, which is the one I would recommend everybody uses. These are temporary fillers, and hyalase is an enzyme, which is, by the way, already in your body, which can dissolve these fillers within 4 to 6 hours. So yes, lip filler can come out. Can lip filler get infected? Well, yes, it can get infected. Anything can get infected if you break the skin and introduce microorganisms in low immunity states. So we can have lip fillers getting infected, but this is probably much more common in permanent fillers. So again, hyaluronic acid fillers, I've been using them probably 20 years now, maybe a little less, and touch wood, up to now, I haven't seen a single case of infection with hyaluronic acid fillers in the lips. Maybe we've just been lucky, but that's the statistic. Can lip fillers, and the last one, whoa, too aggressive. Can lip filler be removed? I guess that is the same as coming out. So the answer is yes. Lip fillers can be removed. if they are temporary hyaluronic acid fillers. If they're permanent fillers, they can still be removed, but that would depend on whether your permanent filler, let me fix this, is something that has integrated with your tissue, or is it something that sits like, well, like a breast implant, which is essentially removed from the tissue, but a little lake of filler in the tissues. Here they can be punctured and expressed out, and we've done that a few times. Other times, if it integrates with the tissue, then we actually have to, unfortunately, reduce the lip by cutting out bits of your own lip tissue. And that has been done too. So in a nutshell, all of these questions are frequently Googled questions, which I hope this little session has been helpful. And we're going to run this on quite a lot of other commonly asked questions for non-surgical procedures. Have a good day.